Welcome us to today, Thursday, 12th November 2020. It's another beautiful day for the national briefing on COVID-19. It is my pleasure this afternoon to welcome members of PTF, the chairman of PTF, honorable ministers. And today is a special day because we have the DG of the NYSA with us. With that opening introduction, may I please at this time invite the chairman of PTF to set the stage for his opening remarks. The SGF, sir.
Presidential Task Force, distinguished ladies and gentlemen of the press, let me start by apologizing most profusely for the late start of this national briefing by the Presidential Task Force, and to thank you for your patience. We've not had this briefing now in the last 10 days or thereabout. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for today, Thursday, 12th November 2020. The Presidential Task Force is still monitoring situations around the world and will continue to raise the flag, a red one for that matter, so that Nigerians pay attention to the rising number of cases, especially in high-burden countries. It will particularly help in planning to or not to embark on trips. The candid advice of the Presidential Task Force still remains that non-essential trips should be totally avoided, especially to countries that have shown a resurgence of the COVID-19. Global cases crossed the 52 million mark as of today, with the United States of America, India, and Brazil accounting for 48% of all global cumulative burden. The US has been recording over 100,000 cases daily in recent times. As a matter of fact, yesterday's tally recorded 144,000 new infections in the US. And the rate of fatalities is increasing in the UK and other European countries. 5 countries, USA, Brazil, India, Mexico, and UK, account for 53%, accounting for 685,176 of global deaths. On the African continent, Morocco, South Africa, and Tunisia reported the highest cases in the last 24 hours. South Africa now accounts for 38% of the total cases on the continent, up from 50% as at September. Nigeria now ranks 6th down in Africa, and we don't have to let our guards for a second wave to occur. The number of cases have been fluctuating lately, and that is an indication that we are not out of the woods yet. The cases in Lagos, where multiple infections were recorded in 2 schools, are typical examples of the danger of reopening institutions without the required measures. And it's an indication of what is happening in the community, because the words are coming from homes in the communities. The PTF urges Nigerians to take responsibility to keep our nation safe by adhering to all COVID-19 preventive measures. It is our collective responsibility. We must all rally around each other to stop the pandemic from destroying our lives and our livelihoods. The Presidential Task Force believes strongly that now is the time to raise the tempo of not just our national response, but also our preparedness for a new wave of the pandemic, or any other pandemic for that matter. For example, it has been strongly observed that places of worship, gatherings, weddings, and other social events have dumped the use of face masks and adherence to the other non-pharmaceutical interventions. The PTF is still very much concerned about the mental health of survivors of COVID-19 virus. In this regard, the Presidential Task Force is following reports from researchers around the world regarding the state of psychiatric health of survivors and has intensified plans for in-country response under the treatment and post-treatment regimes. Let me use this opportunity to urge all Nigerians to come out for regular testing. Our testing rate is very encouraging. Mauritius, for example, has the highest tests per million, 218,535, while Nigeria stands at 3,605 per million. Compare the ratio with Mauritius, with a very small or negligible population compared to our country. This is grossly too low to be at a comfortable stage of defeating the pandemic, considering the size of our population, like I said. We are running to about 200 million people. If our ratio stands at 3,650 per million, that will give you an idea of our testing rate, not the capacity. We have installed in place ability to test more than 15,000 a day. But if you look at the figures that are coming out of the Nigerian Center for Disease Control, you appreciate the way we feel about our testing figures. This afternoon, distinguished ladies and gentlemen, we received the report of the demise of the former president of Ghana, Jerry Rawlings. We commiserate with the president, government, and people of our sister country and pray for the repose of his soul. Similarly, on the 10th of November 2020, COVID-19 took another high-profile victim in the person of Saif Erekat, the PLO chief negotiator. We also commiserate with the Palestinian Authority on this great loss. This will no doubt have a tremendous impact on the peace process, even in the Middle East, because he has been a towering figure in the negotiation processes for the last couple of decades. And these two losses underpin the seriousness and the virulent nature of COVID-19, that it is no respecter of persons or office. As I was coming here on the social media, I saw a clip of the late president of Ghana, Jerry Rawlings, directing traffic in Accra. So simple, with a shirt and a trouser, full of life, directing traffic. Not a traffic warden, a former president, both military and civilian, but enjoying the fact that as a leader, he can offer services even out of office. But you can see the devastating nature of COVID-19, that even at this stage, It did not respect its office or his person. So it is important as a people, as a country, that we begin to refocus and redirect our attention in ensuring that we do not let our guard. The figures that are coming out of other climes is not suggestive of the fact that COVID-19 is going away very soon. In spite of the success story about the vaccines that are online, you can see the competition even for the vaccines, acquisition of the vaccines, already getting heated up. It will take a while, even if the vaccines are available, for us to be able to acquire for distribution and utilization in our country. So the only weapon that we've got right now that we can use to aggressively fight COVID-19 is still the non-pharmaceutical interventions that are readily available and they do not come with any cost. Wear your mask, maintain social distancing, avoid unnecessary congregating in large crowds, and just observe the basic self-discipline of washing of hands or the use of sanitizers. Let me use this opportunity to, as always, thank our development partners, the EU, the United Nations Basket Fund, the CAR COVID, and the media. Without your support, this effort would not have traveled this far. I now have the pleasure to invite the Honorable Minister of State for Health, thereafter the Director General of the Nigerian Center for Disease Control and the National Coordinator to give you technical updates for today. I thank you for your listening and have a very wonderful evening. Thank you.
180 new confirmed cases and 2 deaths were recorded in the last 24 hours, bringing to 64,516 the number of confirmed cases so far recorded in Nigeria, from 697,544 persons tested. A total of 60,737 cases have been treated and discharged, while there are currently 2,617 active cases currently receiving care at home or in a health facility. Sadly, we have recorded 1,162 deaths with a case fatality rate of 1.8%. We are cautiously impressed that the number of active cases is reducing as more persons are being discharged and the recovery rate is increasing. We are committed to sustaining this gain by ensuring quality care for all those who test positive. Officers of the Federal Ministry of Health, the NCDC, and the National Primary Health Care Development Agency, in collaboration with some of our partners, are on supportive supervision visits to the state treatment facilities. This is to ensure quality assurance, and strengthen case management capacities in all our facilities. While we strive to contain the spread of the disease, we continue to keep our eyes on other diseases that threaten the health of our people. And one of such diseases is Lassa fever, which is a viral hemorrhagic disease characterized by one or more of the following symptoms: malaise, fever, headache, sore throat, cough, nausea, vomiting, diarrhea, muscle pain, chest pain, and in some cases, hearing loss. So far this year, we have recorded 1,131 confirmed cases in 27 states. However, the number of new confirmed cases of Ebola has increased from 3 in the last week to 11 cases this week. This year, we have recorded 233 deaths with a case fatality rate of 20.6%. This is slightly lower than the case fatality rate for the same period in 2019, when it was 21%. Although nearly 3/4 of the confirmed cases are in Ondo State, Lassa fever can affect anyone, anywhere. We therefore advise all to be vigilant, and especially as we approach the season when we usually record increased incidence. We know that fatality is lower if the patients report early for treatment. We therefore advise that any individual presenting with the above symptoms and with either a history of contact with excreta or urine of rodents, or history of contact with a probable or confirmed Lassa case within a period of 21 days of onset of symptoms, or any person with inexplicable bleeding, to visit the nearest health facility immediately for testing and treatment. We are investigating the incident of unexplained deaths in Delta and Enugu states. Our team of experts have been dispatched to the states to support the state investigation. In Delta State, 23 cases have been reported, with 17 deaths, while in Enugu State, 51 deaths have been reported. In both states, most of the affected cases are males aged between 1 and 55 years. Most reported cases presented with fever, headache, fatigue, weakness, jaundice, abdominal pain, vomiting with or without blood, nose bleeding, blood in stool or urine, convulsions, and unconsciousness. As of the 6th of November, 3 samples from Delta and 1 sample from Enugu have been confirmed positive for yellow fever. We shall provide further details and updates at our subsequent briefings. Thank you very much.
Presidential Task Force, honorable ministers, DG, gentlemen of the press, thank you very much for joining us one more time. Today, the briefing from my side will be fairly brief. Firstly, a quick update on work we're doing across the country to reopen safely the National Youth Service camps. You can see we've been joined today by the DG, who I'm sure will give a few minutes to also share some of his views on the reopening. But we've been working across every state in Nigeria simultaneously to reopen our camps. On Monday, we briefed the press together with the DG on the plans. Those plans are now being executed simultaneously across all the states in the country. Young Nigerians, males, females, are returning to camp through an enhanced safety process that includes risk communication, infection prevention and control, the use of masks, temperature screening, and critically, testing every single one of them, returning to camps. 800 people returning per state in every state in the country for the first stream will be tested for COVID-19 using a rapid antigen test for the first time in our country. I'm extremely proud of the work that we have done together with our colleagues in NYSC. It's been a very strong collaboration, but also critically in collaboration with NYSC core members themselves. Young men and women, part of NYSC, have really taken this on as a challenge. They all want to restart their service year, and so they have really been proactive and progressive in working with us. So from a scenario of just working with them to reopen their camps, we have transformed our objectives in terms of recruiting 200,000 young people that will be recruited into NYSC this year to be champions for public health, champions for the COVID-19 response, and work with us as they're deployed to their various states to champion the work we're doing. So we're training them throughout the camp, throughout these 3 weeks, not only to keep themselves and their colleagues safe, but to become champions and advocates for keeping Nigeria safe. So we're very happy with this collaboration so far, and we think it will yield very good things for the country. Secondly, like I said, we're using a new test, a rapid antigen-based rapid diagnostic kits, 2 specific types from Abbott and Biosensure. These are the 2 that we have permitted use in the country so far. The data from this exercise will not only serve for its primary function of detecting cases in this setting, but also enable us to make some longer-term decisions on the role of antigen-based rapid test kits in our testing strategy moving forward. Over the last few days, you would have heard some good news in the horizon. The announcement of the first vaccine with 90% effectiveness. However, we don't have the details yet. With every piece of work like that, first, there's a press release, but secondly, we soon expect to follow up with data so we can be more clear on what the study has shown and how we can use these vaccines. There'll be a series of other similar announcements awaited over the next few weeks. The National Primary Healthcare Development Agency is leading Nigeria's engagement with thinking around this. The vaccines will come with different opportunities and challenges. It won't be as straightforward in the beginning. Some of them will require very difficult cold chain arrangements. So we hope that as new vaccine opportunities emerge, we will have a broader landscape from which to choose. But we're grateful that NPHCD is leading Nigeria's engagement in this regard, and we hope to learn more over the next few weeks. Also, the prevalence survey, national prevalence survey, is going on well. Everything is going according to plan. We've completed sample collection in 4 states. We are looking to add 2 more states before the end of the year. We've chosen Delta and Sokoto. Therefore, we will have results from 1 state in each of the 6 geopolitical zones before the end of the year. And this will really help us come to some form of conclusions on how widespread transmission was in Nigeria over the past 10 months that we've been dealing with this new virus. And finally, I really want to thank many states that have kept pushing, both on testing and in other aspects of the response. Nigeria is a complex, big country, so it's very difficult to say everybody is doing well or everybody is doing badly. The truth is somewhere in between. Many states have done very well and continue to do very well in responding to this outbreak, and we really want to thank those states and the leadership of the states for continuously pushing their teams and getting the results that we're seeing. Finally, you would have seen reports in the media. We've started seeing the emergence, the dry season of other infectious disease challenges. We've confirmed yellow fever now in 2 states. A new cluster is happening in Bauchi. It might also be yellow fever. We have confirmed the cases that were said to be a strange illness as yellow fever in Enugu and Delta states. This is the time, like the Honorable Minister said, where we generally have an increase in Lassa fever. So what it means is that we have to continue the work we're doing throughout the country and really raise the focus that we've placed on infectious diseases. And we're working very hard with many other parastatals and agencies to move our focus from single infectious diseases to really have a health security approach to the work that we're doing so that we can continue keeping Nigeria safe from infectious diseases and support all of us to return to some form of normality. But as we inch towards the end of the year, I'm sure the national coordinator will say more about this, but just to add something on it, we really urge people to limit the non-essential travel they're thinking about. Any trips outside of the country, especially to countries of higher incidence, if it's not absolutely necessary, if it's not for essential work-related responsibilities or similar, before you even talk about testing or not testing or all of that, the advice that we have is if it's not important, if you can wait another year, please do not travel. Let's stay in Nigeria and make sure that we're able to manage, continue managing the disease as we have so far done. Thank you very much.
That we have been working over the last 9 months in placing restrictions and subsequently relaxing these restrictions with regards to COVID-19. We have now reopened businesses. We have allowed the civil service to fully resume offices, and we've reopened both our domestic and international travel. We've also reopened schools, and our next focus has been the resumption of NYSC activities. And this is why we have DG NYSC here today. Hopefully he'll be given a few minutes to let you know about his experience with regards to mobilizing 66,000 corpus for the start of the 2020 NYSC Batch B commencement exercises. As the DG will probably mention, the resumption will be in 3 phases, extending into January 2021. We have worked closely with NYSC through NCDC and our own PTF pillars to ensure that groups are smaller, they are more manageable in order to ensure full compliance with COVID protocols. We've also ensured that NYSC staff are trained and compliant with COVID-19 safety measures. We have developed and published guidance materials to provide NYSC staff and core members information with regards to preventing infection. The PTF, through NCDC, has also trained NYSC officials to respond to positive cases of COVID-19 effectively. As mentioned by DG NCDC, we have commenced the process of testing core members. In fact, we've already tested more than 12,500 NYSC core members so far using rapid diagnostic tests with confirmatory PCR. In addition to this, we are aware that some of the graduates are international graduates. So for those that are coming into the country, they have to do the mandatory 7 days isolation, compulsory isolation before they report to camp. There's no doubt that this is a massive operation We congratulate NYSC for doing an excellent job thus far, for keeping our camps safe, for ensuring that positive cases are referred to care promptly, and for making sure that an outbreak does not happen. And where it does, we are informed immediately and action is taken. There's no doubt that we need to celebrate the progress we have made, but this is certainly not the time to relax. We still have to be on our oars. I wanted to briefly also talk about the issue of international travel. The PTF is very concerned about an audio recording spreading disinformation that travelers do not have to pay for their repeat PCR test. The federal government has not at any point cancelled the mandatory payment of tests at day 7 for international travelers. The PTF guidance is very clear. If you are abroad and coming into Nigeria, you must get a PCR test for COVID-19 within 5 days of departure. Before departure, you must register on the Nigeria Travel Portal, which is nitp.ncdc.gov.ng, nitp.ncdc.gov.ng, and book and pay for your repeat PCR after you have provided information on your health status and uploaded your COVID-19 PCR result. You book and select the lab that you would like to have the test with. We now have labs across the country, private laboratories that provide testing for international travelers, and you pay for the test to be done 7 days after arrival. The tests are paid for by passengers. They are not free, unlike public health tests that are related to public health issues. It's extremely important that passengers comply with the guidance we have provided when it comes to international travel. We all have the responsibility. We all have a role to play. As mentioned by the DG and CDC, we are strongly discouraging passengers from traveling from non-essential travel. We know that we are going into the Christmas period. The PTF is already looking at steps to minimize the surge in passenger numbers that we see during this period. But this will primarily be by discouraging people from non-essential travel. If you do not need to travel, please stay in country during this period. If you are outside the country, now is not the time to start coming in on holiday. And if you do have to come in for holiday, be aware that you have to do the mandatory 7 days isolation before you show your face anywhere within the country. And you have to be tested and confirmed to be negative in order to exit self-isolation. We will not be relaxing the rules simply because it's a holiday season. We know what is happening in Europe. We know what is happening in the United States and other parts of the Americas. We cannot afford to have another second wave. Even as we are, we haven't flattened the curve yet. And we do not want to continue having reintroductions of COVID-19 into our country. When we tested the first 5,000 plus passengers coming into the country, we had about 105 positives from people who were previously negative on arrival. When we open our airports fully, with more than 5,000 passengers coming in every day, between 5,000 to 7,000, the potential is we could have up to 150 new cases being introduced into the country every day. We cannot allow that to happen. So we must work together to ensure our airport screening is effective, especially during this coming holiday period. The PTF does not want to suspend flights, but at the same time, we will not sit back and allow introduction of massive cases of COVID-19 into the country. I also wanted to briefly talk about the recent violence and looting that followed the hashtag #EndSARS demonstrations. We know this has affected COVID and their ability to distribute, to deliver palliatives. Nevertheless, we would like to acknowledge and commend COVID for their efforts in donating palliatives to the public. Through their generosity and altruism, they have resourced a significant amount of money in order to contribute to the palliative response in the country. COVID has kept careful and transparent records of the distribution process. We can confirm that the donation initiative is currently 95% complete, even though we have seen a lot of looting of some of the warehouses under the state government. Nevertheless, delivery is 97% complete for states in phase 1 and 2 of the distribution. They have 3 phases, states in 3 phases. So phase 1 and 2, states 97% complete, and states in phase 3 have received 90% of their supply. State governments that have received their donations are responsible for the distribution of these palliatives to their local government areas. We ask beneficiaries to please cooperate with the state and local governments, and we welcome the plan by COVID to provide detailed information on the resources that they have put in, not only for the palliative exercise, but also for the donations they have made to government and other parts of the COVID response. Finally, we know the past 9 months has been difficult for us all. We have worked tirelessly together to make sure that we get on top of the COVID pandemic and to reopen our economy. Our children are back in their classrooms, and our youths have resumed their orientation exercise and are looking forward to their careers. There's no doubt that we have all made sacrifices. These sacrifices should not go for nothing. We must continue to work together and support each other, and in particular, the vulnerable parts of our society, those that are most likely to have severe illness. It is very clear that this pandemic is not over yet. We must continue to protect ourselves and loved ones. Thank you.
Thank you very much, Dr. Sancho.
And Chairman, PTF, honorable ministers, Director Generals here present, members of the press, ladies and gentlemen. It is indeed a privilege and honor to address you this evening. Last Monday, just as the DGNCDC said, we had a media chat with you members of the press. Critical questions were asked and explanations were made. The NYC, as the DGNCDC said, has been very proactive in preparation for the opening of our camps. And all the safety measures, as directed by the NCDC, have been strictly adhered to. Mine is to thank the PTF, the National Coordinator, the NCDC, for having partnered with us effectively. They go around our camps, they train our corps members, and also our staff to ensure that we adhere strictly to the protocol. The NCDC Director General and the NYC management, we also had a webinar meeting with all the prospective corps members on what is expected of them in camp. And I'm happy to report to the PTF that the corps members adhere strictly and promise that they will take responsibility to ensure that the safety measures as advocated by the NCDC is strictly adhered to. So you also recall that the corps members also were involved in the fight against the COVID-19. through the skills acquired by these corps members in camps, they were able to produce sanitizers, face masks, disinfectant soap, among other items. They also, from their allowance that was increased from 19,800 to 33,000 by Mr. President, contributed money among themselves to distribute palliatives to indigenous Nigerians. They also sensitized their various communities on the protocols. Apart from that, those in the educational sector also provided online lectures, teaching free to exiting classes of GS3 and SS3 nationwide. My children also participated in exercise. So I can assure you, sir, and this gathering, that so far, just as the National Coordinator said, before I entered, the over 13,000 corps members have registered. And in line with the protocol, all the corps members were given appointment. And except you have to come on the day given to you, you are not going to be attended to because we want to avoid overcrowding and so on. And I want to assure that everything is working fine. And once again, I want to thank the federal government for their abiding faith in the scheme. And also all the entire effort of the PTF, the National Coordinator, and the NCDC to ensure that all the protocols are provided. I want to also appeal to the press that should please work closely with us and the NCDC so that the social media would not spread false news and they cause confusion in our camps. Thank you very much.
Thank you very much, DG. You were quite on point on those issues. Well, there is an update we want to take from the aviation sector. Please permit me now to invite Captain Musa Nuhu, DG NCA, to the podium for update.
The chairman of the PTF, fellow distinguished members of the PTF, an update from the aviation industry. Efforts are ongoing to reopen both Malam Aminu Kano International Airport and Port Harcourt International Airport, Omagua, to international traffic. Just 2 items to go before this are done. And the reason behind opening this airport is to decongest both Lagos and Abuja airports, and also to facilitate passenger travel, as passengers will arrive much closer to their destinations. So make travel much more convenient for passengers. Instead of people coming to Lagos, then taking one mode of transport going to Port Harcourt or Calabar or Enugu, they land Port Harcourt. If you're in Port Harcourt, you're home. If you're going to Enugu or somewhere, you're much closer to home. So also applies to Kano. There are 2 issues to be resolved. The issue of ICT infrastructure, which the COVID is working on providing. And at this point, I would like to use this opportunity to express our gratitude to COVID for their full support they've given to PTF in all its efforts, and also the support they've given to the aviation industry in the resumption of flights. The second item that needs to be done, the Pulse Health Services, they are working on getting adequate number of staff that will man these 2 airports 24 hours a day. And that should be completed very, very soon. So once those 2 items are taken care of, both Kano, Malam Aminu Kano International Airport and Port Harcourt International Airport in Omagua, Port Harcourt, will resume for operations. That's all for aviation for today. Thank you. Prospective date, but very soon. Very, very soon. Yeah.
Thank you very much, DG, Nigerian Civil Aviation Authority. Well, we're now going to take some questions. I know that we have questions.
Say that, I can also tell you that we have bio-vaccine group in Nigeria that is working with the various bodies throughout the world that are making efforts in vaccine production against COVID-19. So we will look at the one that suits our purpose at the end of the day, and decide what to do in our own circumstance. But I'll probably just invite the WHO country representative to shed more light on this issue of vaccine. But maybe before he does that, I will invite the DG and CDC to talk about the Ebola thing. Thank you.
So the question of Ebola is one that we'll keep watching. There's a small cluster happening in DRC with been a couple of outbreaks over the past 2 years, but this is not a case in Nigeria. But it's very important for us as we go into the travel season to recognize where cases are happening in different parts of the world and the continent and be aware of the risk that we face. But that is also linked to the question I think Amaka asked on how prepared we are for the emergence of other infectious diseases that we're now seeing. Yellow fever, the clusters around Lassa fever. It's important to first remember that the responsibility we have around infectious disease is a joint responsibility. Very often we ask, what is NCDC doing? I often throw that question back, what are you doing? So yellow fever, for instance, is a vaccine-preventable disease, a vaccine that is freely available to every Nigerian through the routine childhood immunization program at every primary health care center in the country. A lot is invested in making these vaccines available. We just have to go and take them and protect our children from getting these diseases. So there are many diseases when we have them, when they're new, like COVID, yes, we agree we have to set up a presidential task force, we have to respond to it. But it's very painful when we have to respond to yellow fever outbreaks because they should not be happening. If only we did the little that we have to do or we should be doing ourselves as fathers, mothers, citizens in protecting ourselves. But the other important disease that we don't have a vaccine for yet is Lassa fever. And yes, this is the time of the year we start seeing an increase in cases. They increase up to February, March, and then they start declining. And this is where we really have to rely on some of those measures. We speak about this every single year. We know how the disease is transmitted through rodents, so we have to protect our food from those rodents. It's complex but simple at the same time. But the key thing, I think, in summarizing all of this is health security is becoming more important in our work. And we have to move away from the single disease focus to really investing in preparedness against all health security threats. And that is really the direction the country is going in supporting the work NCC and its partners are doing, in taking a horizontal approach, creating platforms to protect us against all infectious diseases. And that's our strategic approach at NCDC. That also leads us to our the last question I just wanted to touch on vaccines and access to low and middle income countries. WR of WHO will say a few more words on that as well. But the key thing is to give Nigerians the assurance that we're working together through a WHO-led coalition with Gavi and CEPI called the COVAX facility, through which we have more or less agreed that 20% of our population will have initial access. Every day that pool we're working to increase that pool, but we are thinking about this every single day. There are many aspects to the vaccine, not just the vaccine. We have to work on vaccine acceptability so that there's no hesitancy around who wants to take the vaccine. So we have to make sure that people are confident that the vaccine will protect them and actually come out. There's the issue of logistics that have just been discussed. We don't yet know which vaccine essentially we will obviously be going with, but the only vaccine available at the moment or for which results have been announced will require a cold chain of storage of -70, -80 degree freezers. We have a series of them in the National Reference Lab. Just the funds that we pay to NEPA to AEDC every month to keep the power on in order to keep those refrigerators powered is just an example of the challenging logistics that will be involved. So some of the other vaccines might not require that level of logistics to store. So there's a lot of thinking going on. This thinking is being led on for the country by MPACDA, and we are confident that they will lead us collectively in the right direction as new vaccines emerge. Thank you.
For the sake of clarity, we want to confirm if the 11 cases of Ebola, which the Minister of State referred to, if they are in Nigeria.
For clarity, there are no cases of Ebola reported in Nigeria today. Thank you very much.
Test kits. They have provided ventilators and oxygen equipment. They continue to a large extent support the technical side of the PTF work. When it came to opening the international airports, they played a significant role and continue to play a significant role. They are responsible for ensuring the operation of the payment portal currently, and we wouldn't have been able to open the airports at the time we did if not for the contribution of CACOVID. When it comes to palliatives, they have put in a tremendous amount of resources into the palliative response. They have provided food and food material to every state in the country. This is no doubt a massive exercise, which required a lot of logistics and a lot of arrangements, and had to be done in phases in order to avoid pushing the price of food and pushing inflation within the country. They have handed over most of these foodstuff to the state governments before the unfortunate event happened. So as far as the PTF is concerned, we strongly believe that CACOVID will not be discouraged. They will continue to work with us to make sure that the commitments that they have put in place are delivered, and to make sure that the palliatives they have handed to the state governments are distributed to those that need them most. And the PTF will continue to support them in this regard. Thank you.
The question directed to me has to do with hygiene. Just as I said earlier, we had partnered effectively with the NCDC. We were given a checklist. And with the checklist, they visited all our camps nationwide to verify. And I'm happy to inform you that all these are complied. If you go to our camps, we have wash hand points in all parts of the camp, from the entrance to the hall, our serving points, and so on. Outside the hosted area, we have washing hands points. So all these things were certified by the NCDC. I know we also have a Vanguard committee comprised of the core members, NYC staff, as well as NCDC staff that goes around to ensure that strict compliance with the protocol are adhered to. We have NCD staff in our camp. They stay and sleep with our core members in the camp, so to ensure that we have a safe orientation exercise. Thank you.
Thank you for your question. I would like to complement the answer on vaccine, COVID-19 vaccine, the answer that was given by Excellency the Minister of State and the DG NCDC. As you know, there is this COVAX initiative that was launched as a mechanism, first of all, to support accelerated vaccine development so that more vaccine, more doses could be available in a short time. As you know, development of vaccine usually takes more than 10 years, can take decades. But through this mechanism, different firms, pharmaceutical industry, are being supported to accelerate. All the countries in the world, all the economies were invited to join, to subscribe. Today, there are more than 186 economies that have subscribed. Both development countries, rich countries, and low and middle-income countries. And Nigeria is one of those countries that have subscribed to this COVAX initiative. The principle being that the developers, the research and development is supported, funds is mobilized to support the industry to produce vaccines. Today, there are more than 200 candidate vaccines, of which about 47 are in a human trial, of which about 10 are at the advanced stage of clinical trials. And the Pfizer one is one of those that were at advanced stage, but there are others. We had communication from Pfizer about the early indication of the efficacy of the vaccine, and of course, some economies reserving some doses. But through the COVAX initiative, WHO was clear. Like if we are to control this pandemic, we have to vaccinate first 20% of the population who are most vulnerable, not in one country, but everywhere in the world. That's the only chance we can get to control this pandemic through vaccination. So countries have subscribed. WHO, to ensure that all the countries in the world could benefit, has developed an allocation framework, which is part of the vaccine facilities. And that allocation framework is based on certain key principles. The first one is solidarity. The second one is ethics. The third one is the public health response as a basis for our action and targeting the most vulnerable. All the countries that have subscribed understand that if there is a single country that is left behind, it could be that country that could be at the origin of another wave of the infection. So there are more than 186 countries and economies that agreed to those principles. Countries are also expected to contribute. Most of the cost of the vaccine will be borne by that mechanism. And there are several donors who already provided the funding for that. The facility itself was estimated around 38 billion. Two-thirds of that amount has already been mobilized, and the other one is being mobilized. So the principle is for all the country.
If you ask me, am I excited about the prospect of a vaccine? Yes, I am. But am I very hopeful that it will be available very soon? No. It's not going to be available for use very soon. And you've heard the representative of the WHO about the politics and the intricate arrangement of how it is even going to be distributed and shared. By the time the world decides that 20% will go to the most vulnerable, you know that you and I don't fall into that category. So it means that you have a long wait. The truth about it for me, I already have the vaccine. And the vaccine is just to wear my mask and maintain social distancing and avoid congregating in large crowds. Let me use what I have now as I await the arrival of the vaccine. Let me use what I have. And that has been my message all these last months. Let's use what we have. If the argument or the desire is to wait for the vaccine, and for that reason, we let our guard down, with what is happening all over the world, we might not be able to get to the point that the vaccine will catch up with us. So the most important thing, and the message for us particularly in this part of the climb where we have to wait, and vaccines will be available when those that have resourced and cornered the vaccines have gotten a certain proportion. I've listened to this thing on the television, and I've watched the body language of even the people that are advancing the course of the vaccine. Definitely, probably in the next 1 year, they will be able to produce a vaccine that will cover about a population of about 1.5 billion people. Right now, the world population is over 7 billion. And the processes of the distribution, when I heard that you have to get a refrigerator that operates under -80, I said, well, that in itself, logistically, is a major constraint. We had vaccines in some of the warehouses that the hoodlums broke into, and they took the vaccines. They were running up and down with it, not even knowing what the vaccines are meant for. So we have an infrastructure that even the distribution of these vaccines will be a major challenge for us. For crying out loud, we already have what we can do, what we can use to protect ourselves, our loved ones, and by extension, protecting the nation. So let's dwell on that. As inconvenient as it has been, right now, as a matter of fact, oftentimes when I put off my mask, if I'm alone, I feel a little bit odd because it has become part of my feature. And that is why I want each and every Nigerian to get to. That self-preservation is very, very important.